Models of performance management in times of organizational restructuring and financial stress. Best practices for high-performing health insurance companies. Presented by Leigh, Hause, Amberton University Graduate School of Management for Professor Deanne Sanchez, May 2017. Purpose of project. Access to comprehensive, affordable health care is of primary concern globally. In the U.S., the recent presidential election has stirred the flames of redefining health care. Access, costs for the government at the federal and state levels, cost out of pocket for employers and those able to purchase insurance outright, what is subsidized, how pre-existing conditions are managed, what is included in basic coverage, mental health, substance abuse, maternity, and reproductive care. Because the health care system is rapidly evolving, there is a need to employ competent, efficient, and compassionate staff to manage the functions of health insurance companies. Rapid change to regulatory guidelines and therefore company products and processes means insurers have to find a way to maximize employee performance management. Financial crisis brings opportunity to invest in new performance management strategies to attract, grow, and keep top talent. The current political climate creates an uncertain future and keeps change as the primary advantage and strategy in healthcare insurance companies. The strength of the healthcare industry lies in the quality, integrity, and innovation of their staff. Healthcare companies that do not have innovative performance management models will fail to engage staff in the constant change process and diminish opportunities for continuous performance improvement. Health care insurance industry overview. The concept of health insurance grew out of accident insurance during travel by railway and steamboat in the late 1980s. In the 1910s, the progressive era of Theodore Roosevelt saw significant debate over the role of government in healthcare. The focus of healthcare from the public was the cost of missing work due to being sick or injured, and on-the-job injuries were far too common, for which employees were usually held liable. So during this decade, the majority of states enacted worker compensation insurance. If employers purchased the insurance, the state would help offset the medical costs of treating the injured employee. Some larger employers even retained or hired physicians just to meet the physical needs of their employees. During this time, sickness funds also became popular. The 1930s and 40s brought the creation of something that was new, a hospital prepaid plan for employer groups. Henry Kaiser was the creation of the first program called Kaiser Permanente. In response to his success, hospital prepaid plans sprang up all over the United States and eventually led to the creation of the Blue Cross Commission. From this concept grew patient choice to select a physician, direct payment of the physician by the payment, the health insurance market, and the rise of the indemnity plan, otherwise known as the fee-for-service plans. Towards the end of World War II, the government imposed certain wage controls on manufacturers, making it harder to attract workers in an already strained job market. So employers started using health insurance coverage and other fringe benefits as a method for attracting workers. This drove the growth of commercial insurance companies. Employer-based health plans and the use of experience rating all but solved the risk concerns held by private insurance companies. In the 1940s, only about 9% of the population participated in a form of health insurance. In 1950, the number was over 50% and rising. The 1960s saw the creation of Medicaid and Medicare programs during the Lyndon Johnson administration. Medicaid is a program designed to provide coverage to the poor. It was set up so that the federal government established the basic nature of coverage and eligibility, but then allowed states to decide how much service was to be covered and what income threshold was used for eligibility. Medicare provides hospital and physician services to those over age 65. Medicare is an important part of our healthcare system despite its complexity. In the 1970s, we saw a movement for government healthcare reform. The end result was federal support for health maintenance organizations, otherwise known as HMOs. That was a general term to refer to prepaid health plans that enrolled members and arranged for their care from a designated provider network from which the HMO had a contract. The goal was to have 90% of the population enrolled in HMOs by 1980. HMOs did gain popularity during the 80s and 90s as healthcare costs continued to rise and employers and individuals looked for less expensive options of healthcare coverage without sacrificing quality of care. In another effort to reduce costs, insurers began offering more fee-based business in addition to the traditional risk-based business. In risk-based business, the insurer underwrites the medical insurance, charging a certain amount for premiums and guaranteeing claims will be paid. The risk of rising healthcare costs is assumed by the insurer. In fee-based business, the insurer or healthcare company provides administrative services such as claims processing or network access for a monthly fee. In this case, the employer actually underwrites the medical insurance of their employees, and the healthcare company simply administers the health plan. This model is more often seen with large employers. Many healthcare companies now have both risk-based and fee-based books of business. The current healthcare system is largely based on networks. Current industry trends. Healthcare insurance companies are facing tremendous pressure to adhere to changing regulatory mandates while balancing the demand for cost-effective healthcare. In 2016, the U.S. health insurance industry reported losses of a few $billion selling policies on the Affordable Care Act exchanges, with some companies absorbing large losses. The current political environment in the United States and the ongoing legal battle to repeal and replace Obamacare adds considerable tension. Those companies that are not leading the wave of change management are left scrambling to restructure in order to remain profitable. The increased demand for services, decreased resources, and while trying to meet organizational goals and demonstrated results is a tough feat for any healthcare organization. Those that provide nonprofit healthcare have the added stressors of securing funding from donors and funding agencies, whereas the public sector healthcare companies have to answer how tax dollars are being spent under increased public scrutiny. The high-performing healthcare organizations that are successfully looking towards performance-based management systems that facilitate current transformation that is being driven by governmental action. This is the most impactful shift since the creation of Medicaid and Medicare in 1964. The development of the ACA represents a generational paradigm shift, and millions of Americans are entering the discussion about what they want their health care to be. The ACA is the Affordable Health Care Act, which required that all states offer affordable health care to all of their constituents by January 1st, 2014. The ACA requires all states to submit and execute a plan to operate a health benefit exchange, an HBE, or defer to the federal exchange. The ACA had three main points. 1, make affordable health insurance available to more people. The law provides consumers with subsidies, publicly known as premium tax credits, that lower costs for households with incomes between 100 and 400% of the federal poverty level. 2, to expand the Medicaid program to cover all adults with income below 138% of the federal poverty level. At this time, not all states have expanded their Medicaid programs. And 3, to support innovative medical care delivery methods designed to lower the costs of health care generally. At present, there's a shift away from the fee-for-service payment plans, which reward volume and productivity towards one that favors efficiency and effectiveness. The healthcare industry is becoming more like the retail industry. Due to public and private exchanges, new market entrants, and millions of new customers, this influx is driving massive change and a complete overhaul of the quality and management processes and a new responsiveness to the needs of the customer, responding to multiple demands. Key performance indicators for health insurance companies. It speaks volumes that a number of health insurance companies are found on NASDAQ. These high-performing companies build their success and demonstrate their value to the public as built upon quantifiable metrics. There is an extensive amount of data available that feeds healthcare insurance companies' KPIs, otherwise known as key performance indicators. KPIs include financial and non-financial measures of an organization's strategy to achieve its objectives. They are one of the most useful methods to perform the strategic task of managing and controlling performance. KPIs are widely used in the insurance industry to measure the health of important business processes. Insurance companies regularly use their KPI measurements to benchmark themselves against competitors and identify best practices. Many insurance KPIs focus on the traditional elements of a balanced scorecard, specifically for processes, finance, customer satisfaction, and innovation. Healthcare insurance companies are transitioning to the use of the Net Promoter Score, which provides industry-wide customer satisfaction and loyalty ratings, a methodology developed by Bain & Company in 2003. NPS measures customer experience and predicts business growth. This is a customer service experience management program that a variety of industries use to help build loyalty and growth. The goal of the Net Promoter Score is to measure the loyalty that exists between a company and its customers and answers the question of, how likely are you to recommend us? Ultimately, Net Promoter Score measures customer experience and predicts business growth as well. This is a significant shift in thinking for the world of healthcare, and it can provide tremendous competitive advantage to be the company that sets the insurance industry benchmark for the NPS. For those companies incorporating the Net Promoter Score, this requires a radical shift in considering what defines performance. For health insurance companies facing financial stress and attempting to navigate an overhaul in how performance is defined, this requires further time and money to be invested into bringing their performance management system into alignment with a new definition of performance that is required by the adoption of the Net Promoter Score. Many healthcare insurance companies utilize a pay-for-performance model for their providers and their network vendors and other contracted affiliates. This model aligns well with the customer service focus as defined by the Net Promoter Score. In simple words, Net Promoter Score is defined as a measure of how likely your customers are to recommend your business to a friend or colleague, expressed as a percentage. Customers respond on a scale of 1 to 10. Detractors score 0 to 6, passive 7 to 8, promoters 9 to 10. To find your score, you take the percentage of promoters, then subtract the percentage of the detractors. The best possible score is 100%. Worst, negative 100%, with the benchmark for the health insurance industry set at 67%. The use of NPS signals a shift in the thinking behind healthcare. Sustained, profitable growth is linked to one Net Promoter number known within and externally to the organization. Employee performance management and high-performing health insurance companies. 3 recent trends in healthcare have ignited innovations in healthcare information management systems and are pushing high-performing healthcare insurance companies and their employees to better manage and coordinate Patient-centered care, fiscal accountability, and controlling rising costs. Similar to healthcare facilities, healthcare insurers are being challenged with uniting separate operational systems. What you do with your data can generate new operational applications and deliver more efficient and cost-effective care. High-performing health insurance companies understand industry trends and demand quality staff that can drive towards strategic organizational objectives. Change management, continuous quality improvement, understanding evidence-based information for improved clinical outcomes, adaptive learning to utilize technology that supports quality and efficiency of patient capacity management, resource allocation such as planning staff levels, workload, and scheduling are just a few of the factors that have to be addressed by a robust employee performance management plan. Employee performance outcome data can be captured by scorecards, dashboards, analysis, reporting, forecasting, and other tools. High-performing health insurance companies are aggressively rethinking how to define and manage performance. The annual performance management evaluation is being replaced by the ongoing capturing of objective performance data through the variety of data management systems that exist. This is better aligned with organizational strategic goals for continuous process improvement, as automated data systems provide real-time analysis and can answer in a snapshot individual and team performance management outcomes and answer the question whether they are meeting benchmark performance expectations. Fact-based performance management and development discussions occur on a frequent basis as opposed to annually and replace backward-looking performance evaluations. Bell curves are now recognized as lumping employees together towards an average versus identifying true performance patterns. Ratings and rankings are also being put aside. Pay for compensation to reward the top performers is being actively used as a way to keep top talent. Performance review model implies a continuous cycle as key performance indicators for jobs will change along with organizational goals, strategies over time. The purpose of the performance management system in general is to promote the achievement or organizational-wide goals, so therefore the performance management review system at the individual and team level needs to be in alignment with the organizational strategic goals to drive the organization forward. Each of these 6 processes plays an important role in that each must be completed successfully or the entire process suffers. The link between the processes must be clearly established. 1. Prerequisites. There are 2 critical prerequisites. 1. The need to have good knowledge of the organizational mission and strategic goals. The employee has to be part of contributing to these goals to support the organization's overall goals. 2, there is a need to have a good knowledge of the job in question. This is where job analysis helps to establish knowledge, skills, and abilities required to successfully complete an individual job and what are the essential tasks of the job to be completed. 2, performance planning. This is the process where key accountabilities are developed with consideration to desired results and behaviors, as well as generating a development plan. These key accountabilities are further broken down into specific objectives and performance standards. 3, performance execution. Employers and their managers are both responsible for this process. The employee needs to have a commitment to following job performance expectations and communicating if there's a problem or performance improvement options. The employee needs to have an awareness of how they're performing. The manager needs to be active in observing performance, making sure the employee understands that any changes to organizational goals and also to help support and motivate the employee. 4, performance assessment. The employee and manager both need to participate in the evaluation of the employee performance. A typical tool is self-evaluation where the employee rates themselves, and this helps to establish that the employee understands what performance expectations are placed for that specific job, and it helps to increase employee commitment and ownership in the performance management process. 5, the performance review. This process involves the employee and the manager meeting to discuss employee performance. Typically, this meeting is called a performance appraisal. This can include past evaluation of what the employee has done well or not done well, how they are currently performing, and expectations for future, including growth and development of the employee roles, knowledge, and skills. And 6, performance renewal and recontracting. This is the final stage in the performance process. This stage uses the insights and information gained from the prior phases. This could be a change in sales goals, for example, to match the rollout of a new product line or reduction of sales goals in a recession. Traditional model of performance management. The traditional model of performance management originated in the workhouses of the 1800s. For owners, managing their workers' performance was as simple as assessing their output versus time taken and costs involved. Without the strict employment laws we've come to be protected by today, underperforming workers could be kicked out without any notice. Their individual development was of no consequence to their managers. At present, performance management has evolved to include and to respond to current socio-political and economic factors that continue to shape the nature of work within the United States. This evolution has included worker safety, pensions, standardized wages, and has morphed into what we recognize more recently as management by objectives to pay for performance models. The term performance management developed in the 1970s. The traditional model is centered on an employee appraisal evaluation done annually on an employee's job performance over a specific period of time. This is a past-focused model providing a backwards-looking report card. There is opportunity to assess future goals based upon evaluation of the employee performance outcomes. This model can be labor-intensive and requires training of managers and employees about how performance is captured. That includes tools and methods for tracking metrics and how performance is defined. It becomes the responsibility of the organization to ensure all performance appraisal processes are the same within the same department and across departments. Traditional performance management model has been under scrutiny for the past 2 decades with a focus on negative experiences by managers and employees and the general dissatisfaction they have with meeting once a year to capture a whole year's worth of data in 1 hour. One of the larger concerns is that the focus on an annual evaluation will be highlighted by most recent events versus a consistent sampling of performance evenly across a year. If done well, the system could be beneficial to both employees and managers. If done poorly, it can be a source of frustration. Pros and cons of the traditional performance review model. Strengths. The process generates a document of employee performance over a specific period of time, and this documentation can be in-depth and track performance improvements made. The process provides a formal meeting between a manager and employee to discuss performance, and this can be completed in a non-threatening format. The process allows a manager the opportunity to provide employee with feedback about their performance and discuss how well the employee goals were accomplished. The process provides a structured opportunity for an employee to clarify expectations and discuss issues with their manager. The process allows for establishing specific goals for the upcoming year. Annual evaluations can motivate employees if supported by a good merit increase and compensation system. Weaknesses. It is difficult to monitor how individuals have developed between each assessment due to the length time scales involved. It is difficult to track a whole year's worth of performance in one document. It can undermine employee development as the review is past focused. If not done right, the traditional performance review can create a negative experience. Performance appraisal appraisals are very time-consuming and can be overwhelming to managers with many employees. They are based upon human assessment and are subject to rater errors and biases. The traditional performance management review can be a waste of time if not done appropriately, and they can create a very stressful environment for everyone involved. Characteristics of an ideal performance management system. The working definition of a performance management system refers to the continuous process of observing, measuring, and developing performance in the organization by means of linking each employee's performance and objectives to the organization's overall missions and goals. In essence, this includes developing achievable performance benchmarks, a clear path of performance communication that is ongoing. The ideal performance management system will assist and allow for managers to identify the performance strengths and weaknesses of each employee and causes of performance deficiencies. Managers will have the training and skill to provide coaching to their employees with a focus on improving performance management on an ongoing basis. Managers also need to routinely educate and align employees with strategic business objectives. The performance management system supports and provides accurate data for workforce planning. This allows the organization to pivot and respond live time to new demands, whether anticipated or unanticipated, to determine resource priorities. Performance management systems are owned and responsive to employees, and employees have access to and receive ongoing training on how to engage with the system. The system offers opportunities for education, access to resources, coaching, mentoring, and other resources which promote growth and performance. Employees need to have access to education about performance standards and how to meet them, ongoing training as work tasks shift over time. The performance management system includes a reliable and accurate metric that is a platform for administrative decision-making about human resources performance management activities, including salary adjustments, promotions, merit increases, retention or termination, recognition of individual performance, identification of poor performers, and layoffs. An ideal performance management system should be thorough, practical, meaningful, specific, reliable, valid, acceptable, fair, inclusive, open, correctable, standardized, and ethical. Ideally, formal discussion about performance occurs on a quarterly, if not monthly basis, and there is a robust platform of rewards, bonuses, incentives, financial and non-financial recognition of high performance outcomes. Special considerations for performance management systems in high-performing health insurance companies. The healthcare insurance industry has unique features. Care and consideration needs to be given to developing a performance management system that attracts and retains high-performing individuals and work teams. KSAs and KPIs need to be reviewed semi-annually in environments that are experiencing intensive change to better capture needed changes to critical job tasks and skills that support each job. The opportunity for hybrid jobs exist, and jobs with multiple roles are more difficult to define performance ratings to, such as consultation roles, mentorship and coaching roles, project participation, participation in high-intensity work groups. It is not fair for an employee to be held accountable to perform multiple roles, but only to track performance on a few terms. Constantly changing job tasks mean that performance tracking and ratings need to shift as well. The organizational strategic goals of any high-performing health insurance company is complex and requires the alignment of individual employee goals to team performance back up to senior leadership. Health insurers provide oversight to the cost and performance outcomes of the healthcare provider industry, adherence to multiple regulatory processes, efficient claims processing, maintenance of a provider network, sales, innovation of new products and technologies, and end-to-end customer service are just a few of the required service delivery systems embedded in the structure of a high-performing health insurance company. These performance metrics strategically should be linked to the need for financial efficiency across all processes. With continued public scrutiny and political infighting over the existence of insurance marketplace exchanges and what constitutes mandatory coverage, inherently there will be more pressure on high-performing health insurance companies to do more with less while providing premium customer service and quality healthcare outcomes. Special considerations for performance management systems in high-performing health insurance companies. The healthcare industry is undergoing a significant evolution, and business is now being run more akin to the retail industry with an intensive focus on customer services. The industry shift to using NPS, the Net Promoter Score, signals a significant shift in the concept of who we are and how we perform. The shift in organizational identity forces the performance management system to allow a high-performing company to remain flexible and to be able to drive change to meet new customer demands. The use of NPS and customer service focused forces the need for strong brand name recognition with what services you intend to deliver to customers. And employees of these high-performing health insurance companies have to not only understand what that branding is, but how to connect it to customer service. Individual employees need to be educated and understand the strategic goals, branding, and how customer service is now ultimately married to performance. NPS, the Net Promoter Score, in part helps to further refine quality and best practices performance metrics used to drive better performance. Best performance management system options for high-performing health insurance companies. Best practices for performance management systems include: 1. Performance metrics need to be well-defined and openly communicated at all levels of the organization. Operational definitions help clearly define what is being measured. 2. Performance metrics need to be strategically integrated and wrapped around daily operations. 3. Performance metrics provide reliable and valid data utilized to support operational and strategic decision-making. Performance management needs to be fact-based and kept for analysis and decision-making. 4. Performance metrics must be compared with industry ratios and benchmarks. Comparisons should represent best practices for similar activities inside or outside the healthcare industry. 5. Performance results should be trended over time and communicated cross-functionally and vertically within the organization. 6. Performance measurement should align with organizational critical success factors and strategic plans. This allows for senior leadership to review progress and assess organizational performance relative to strategic objectives and action plans. Performance metrics support sound organizational financial practices for growth and sustainability. Pay-for-performance management model. Pay for performance is a common concept in healthcare. High-performing insurance companies are moving to this model with employee performance management in mind. Pay-for-performance model initiatives recognize that the recruitment and retention of top talent is a strategic move. It costs a lot to find and to train employees, and high-performing organizations recognize that top talent means having a competitive advantage. Pay-for-performance models received increased interest by employer groups post-economic recession in 2008. High achievers received increases regardless of whether a base pay increase budget was in effect or not, meaning average performers may not have received any pay increases at all, or their increase would be far below what is earned by the top performers. There are many different designs for the pay-for-performance models. Incentive compensation no longer has to come in the form of an annual increase. On-the-spot bonuses, monthly bonuses, stock options, carving out a portion of merit budgets to be set aside for high performers are just a few of the pay-for-performance options. High performers are attracted to companies that stand by their commitment to paying top performers. Pay-for-performance management model. Various studies support that the pay-for-performance model of employee performance management offers mutual benefits to the employee and the organization, including it improves employee performance, it improves employee retention, and there is an ease of administrating and understanding the performance management model over other models. The pay-for-performance model is common in the technology and information-driven sectors and helps to drive employee competition. Pay-for-performance plans and systems can promote a success-driven culture where the desire and need to be the best, the drive to receive more income, increased freedom can shift organizational performance levels. Pay for performance is most often used in more traditional performance and results-driven environments like sales or production, but it can be extremely effective in driving competition in support roles like informational technology and human resources. Many organizations use some form of pay for performance routinely as part of their overall employee performance management model. The reason why pay for performance is used as an employee performance management model differentiates between high and low performing organizations. High performing organizations have clarity about why pay for performance is a strategic goal, including to recognize and reward high performers, to increase likelihood of achieving corporate goals, to improve employee productivity, and to move away from an entitlement culture. High-performing organizations are clear that the pay-for-performance model is a longer-term strategy, and the goal is to achieve and sustain a long-term competitive edge by motivating and rewarding and retaining top talent. The pay-for-performance management model. The pay-for-performance model is best conducted in an organizational environment which is fully committed to this model and will set aside appropriate financial resources to reward top performers. Employees must understand the planned performance goals and view them as achievable given their own abilities and skills. There is a clear link between performance and pay increases that is consistently communicated and followed through on by senior leadership. For employees to value and adhere to performance standards as set within a pay-for-performance model, employees need to feel that the rewards are equitable, not fair, but equitable, to the efforts made to achieve high-performance standards. Pros and cons for pay-for-performance management model. The strengths of the pay-for-performance management model are: this model can be used to drive average performer towards becoming high performers via financial incentives. Employees still value pay increases. Transparency and employee involvement in the compensation and performance assessment process can increase employee support of the pay-for-performance model. This model can provide motivation to perform and helps build employee self-confidence and satisfaction. As the job and expectations are defined more clearly, it helps to align performance expectations along with organizational strategic goals. This model also moves employees away from an entitlement culture. The weaknesses of the pay-for-performance management model are: there is the possibility of high turnover of lower performing employees, insufficient funding for rewarding of high performers, unrealistic employee reward expectations, poor modeling by senior leadership, unclear definitions of performance, poor stratification of performance expectations. Not all jobs and organizational structures are benefited by this model, and variable pay, lack of consistency may erode confidence in this reward model and ultimately result in highest performing employees in leaving. Limitations of the study. The history of healthcare and the role of the healthcare insurance company is actively being decided and written. Many studies that need to be done are yet unwritten. Socio-political environmental factors place the healthcare insurance industry in flux, and high-performing organizations have to be ready to adapt to abrupt regulatory changes. Companies that are struggling are being hindered by poor forecasting and potentially antiquated performance management practices that do not support product and technology innovation. Not all Net Promoter Scores data is public, and low performers are unwilling to publicly list data that reflects poorly. The Net Promoter Score is subject to overall trends in consumer sentiment, meaning that consumer trends shape performance outcomes to some degree, which could differ significantly from known industry best practices over time. Conclusions. The current political climate, changes to marketplace exchanges, requires forward thinking on how to manage costs across all groups of insured lives. The sheer number of those who need access to health care versus budgetary constraints and limitations of current facilities to manage patient volume has created a growing demand for virtual and telephonic supportive medical and mental health care. New technology in healthcare allows for healthcare opportunities to reach remote communities or to access those who are otherwise homebound. Healthcare companies who can regionalize service delivery, streamline costs, and use technological integration to simplify and expedite end-to-end user experience for claims, authorization of services, and access to services are those that embrace change and maximize talent of high-performing staff. Recommendations. High-performing health insurance companies need to close the gap between best practices in talent management, employee engagement, and productivity. Organization-centric goal alignment, ensuring employees have clear standards of performance and individual and team goals are linked to organizational strategic goals, is important. Fairness and equity both play a strong role in employee acceptance of performance management models and experience. High-performing organizations will struggle with employee turnover if transparency about the pay-for-performance model does not exist. Employee career and development pathways need to include learning opportunities, resources, trainings, and information for an employee needs in order to be successful. More studies are needed to confirm that pay-for-performance models are helping high-performing organizations attract and retain higher performers. More studies are needed about group pay for performance in combination with individual pay for performance, performance management employee models. Core competencies need to be well-defined, used consistently throughout the employee life cycle, and used in job requisitions to attract the right talent for the right job. This includes an across-the-board commitment to continuous process improvement.